Good afternoon all. David Crisafulli, joined by Ros Bates. Hello all. We're good to go? Well, the latest report into Queensland Health from the Auditor-General paints a tale of woe for the state government's ability to plan, resource and run our health system. And in a moment, Ros will explain what this means for her colleagues on the front line. But first, I wanted to make some observations from the report from the Auditor-General himself. It finds that paramedics lost 134,155 hours in the year. That's up by 20%. That's the equivalent of 37 crews off the road at the end of a ramp for an entire shift every day of the year. Imagine the pressure that paramedic feels when they know at the other end of the phone is a Queenslander they can't help. It finds that patients are waiting longer than clinically recommended for a specialist, 104,000 of them. That's an 80% increase. That's 2 Suncorp stadiums filled of Queenslanders who won't get to see a specialist in time. That is a failure to properly plan and resource a health system. It finds that the number of patients waiting longer to see a specialist increased by 177% in the 5 years to 1 July 2022. It shows that the government hasn't met ambulance ramping targets for 8 years. This isn't the fault of COVID or Canberra or patients or paramedics. It is 8 years of things going in the wrong direction. The government hasn't listened to the solutions that frontline staff have been putting on the table, and for 8 years, year on year, things have deteriorated. It shows despite spending $263 million of taxpayers' money on the Care for Queensland strategy, it failed to improve key performance measures. It shows that the government did not meet its response time performance targets for Code 1. It shows that cyber security risks remain. And finally, it shows that the new hospitals that the government has announced as the centrepiece for their strategy going forward, new hospitals that are half a decade overdue and won't be delivered beyond another half a decade, are already running behind schedule and are over budget. This paints a tale of woe. It paints the picture of what happens when a government doesn't properly plan, resource and run the health system. And please don't blame the frontline staff. And the report shows the job that the AMBOs are doing in going out and doing their job as best they can. It shows the pressure that the doctors and nurses are under, but it shows the failure of the government to listen to the solutions. Better resources, better triaging, sharing data in real time, and above all, putting doctors and nurses back in charge. And finally, before I hand over to Ros, I want to make one more observation. Why is it that it's only ever the Auditor-General who bells the cat on how bad things are, and then the state government comes out and has to talk about it retrospectively? Wouldn't it be refreshing if we could see data in real time? And wouldn't it be refreshing if the government was prepared to actually put this out in the public and let us all work on improving the system? There is a culture in Queensland that is led by the Minister down of cover-ups and of never wanting to share information. And it's only when we have an Auditor-General's report that it shows how bad things are. And this isn't a newfound interest for Ros and I. We have done 28 town halls across the state, and we will be doing more. And we listen, and we hear the stories, the cry for help. And Queenslanders want to know that the government feels the pain that they are in, and they want to know that they're prepared to do something to heal the Queensland health crisis. Hey, Ros.
Thanks, David. Ros Bates, Shadow Minister for Health and Ambulance Services and Registered Nurse. Well, today's report from the Auditor-General shows another damning indictment into the Palaszczuk government and the way that they have handled the Queensland health crisis, which has been knocking on their door for years. We know that nurses and doctors and paramedics were exhausted long before COVID. They were leaving in droves, and they are leaving in droves now. Those hard-working frontline professionals are doing everything that they can for you and your loved ones, and they are frustrated every day. I have whistleblowers coming to me every day telling me how bad the system is, that they don't believe that they can work there anymore, that it is just too much for them. We know that patients are losing lives. We know that patients have been dying waiting for ambulances. We know that patients have been dying on the ramp. And this is yet more proof that the Palaszczuk government cannot plan, run and resource our hospitals properly. In this report, it shows that the long wait list for specialists has blown out by 80%. What does that mean for you and your family? What it means is if you've got a chest problem, a cardiac problem, you can't get to see the heart doctor. If you may or may not have cancer, you can't even get to see the cancer doctor. It is not good enough that these patients are languishing on these waiting lists and not being seen. And as I said, those long wait lists have blown out to 80%. So that's now more than 100,000 Queenslanders waiting to be seen by a specialist. Some of those patients may have died while they have been waiting because they are not reviewed often enough. We need to make sure that these waiting lists are looked at properly, that those people who need to jump the queue, and I can tell you, me, like every other LNP MP, gets complaints from patients and their families every day. And we have been able to help those patients get to see a specialist or get to see their surgery. But we're not seeing the government doing that. And if Hollywood Anna hadn't checked out, she would have already sacked her incompetent health minister who keeps talking down our health professionals, particularly our obstetricians last week. Is it any wonder that obstetricians are going to any other state but Queensland? David? Yeah. I'm sorry, I missed that. I think the Queensland health system is in crisis, and it's been in crisis the whole time that Yvette Darth has been the health minister, and it has been heading that way for the entire time that we've had the Palaszczuk Labor government. You've seen the worst ambulance ramping in the country. Under the LNP it was 15%. Under Anna Bligh, who said Queensland Health was a basket case, it was 30%. Now it's 41%. And to use the excuse that people are moving to Queensland, well, people are always moving to Queensland. I moved to Queensland. So, you know, we need to make sure that we properly plan, run and resource our hospitals. But more importantly, we need to look after my colleagues on the front line. And, you know, even last week I saw 50 years of nursing experience walk out of the Gold Coast University Hospital because they have had enough. Not a day goes by when a colleague says to me, I just can't do it anymore. I feel that I'm not doing my job properly, I'm under stress, I have no family time, I have no life, and it's just not worth it. And that is, it's a very sad indictment on the Palaszczuk Labor government and Yvette Darth.
The report highlights looking into the future, there's increased likelihood of operating deficits in 2023, so budget blowouts kind of makes it a grim picture to come. What do you say to those health workers who are already at breaking point?
Well, I think those health workers groan every time they hear the Palaszczuk government talk about a record health budget and about these satellite hospitals that have no overnight beds. There's not going to alleviate the problem at the front door of our major hospitals. They know that they have needed beds for years. They've been talking about it for years. They just haven't been listened to. So, you know, I know that they just roll their eyes and groan because just throwing money at Queensland Health is not the answer. There is an awful lot of things that you could do to assist my frontline colleagues right now. Things like discharging patients on a Friday afternoon so you've got beds for the weekend, getting the consultants to come in and see those patients, not have a patient sitting in a bed for 2 days waiting for an MRI that they could have had outside the hospital. There are so many minor things that could be done, but this is a government who has stopped listening. David?
There's also in the report we get a bigger picture about some of the losses suffered during COVID. 195 million had to be written off because blood tests are expiring. 18 million was paid in special leave for staff who weren't vaccinated. What do some of those figures tell us about the impacts COVID had?
Well, but it shows you that the government needs to do its job better when it comes to planning and resourcing. And the point you highlighted before was a good one about the future operating prospects of those health and hospital boards. The reason why that future looks shaky is because the government hasn't properly resourced, and the 50-50 funding deal from Canberra will be coming to an end. And we haven't heard peep since the federal election. That was the defining issue of the Queensland Premier during the federal campaign. She injected herself personally into the campaign, saying a change of government in Canberra would deliver 50-50 funding for Queensland Health. Well, it hasn't, and on the surface it won't, and that's deeply troubling. And these figures show that there's going to be some real pain into the future. And to talk about a diagnosis, well, Queensland Health is on life support, and the only thing that's stopping it flatline is the hard-working staff who are clinging by their fingertips, because this report shows how poorly resourced they are, and it shows the failure of the government to properly plan, resource and run the hospitals. And if you read the report, as we've had a brief chance to do, it actually highlights how hard the paramedics are working to try and hold things together. But the numbers don't lie, and ambulance ramping is the worst in the country here in Queensland because the hospital is at capacity and the government hasn't planned properly. 8 years worth of it.
Saw the ambulance response time to Queensland instance target for Category 1. The Auditor General noted that Queensland is actually doing better than other states. So how much better could we actually be doing, do you think, if ramping wasn't such a problem?
Well, ambulance ramping is the symptom of a sick system, and it only occurs when there quite simply isn't the resources to deal with it. And I always look at ambulance ramping through two sets of eyes. I think about it from the person who's on the end of the phone, just praying that the ambo can turn up to help their loved one, but I also see it through the eyes of the paramedic who is on the end of the ramp, and in some cases for an entire shift, each and every day. 37 crews spend a full time every day on the end of a ramp every day. That's what this lost hours shows. And while ambos are waiting at the end of a ramp, at the end of a phone line is a Queenslander who won't get help because the state government haven't planned properly.
So to go back to the office, they've confirmed the Deputy Premier Stephen Miles they won't be renewing the lease for Wellcare. I guess now we've what's your comments on not renewing it?
A $220 million exercise in political muscle flexing, and the big losers are Queenslanders. Imagine what that money could have done in the middle of a health crisis, a housing crisis, youth justice epidemic. Imagine what they could have done. And from the very get-go, Wellcamp was always about politics and never about people. And that'd be okay if it was just politicians having a squabble. But that has cost Queensland taxpayers $220 million. And at a time when cost of living has never been more on people's minds, that'll hurt today to know that the keys are going to be handed back, and it was barely used, and it was never about future-proofing because we never owned the asset. It was a short-term lease designed to create a political wedge with a different colour government in Canberra, and that shows you everything you need to know about the way Queensland is run at the moment.
The Auditor General is looking into some of the lease arrangements and agreements with Wellcare. Do you think that will be one of our only chances to see what happened to the circumstances around that lease?
It'd be a great opportunity for the government to step up and say, we got this wrong and it was immersed in politics, but that won't occur. So it will be up to the Auditor General to do what the Queensland government should. But the comment that I always come back to was how many times the Premier and the Deputy Premier used the word future-proofing, and they always failed to tell Queenslanders that it was a short-term lease and it was never about the future. The only bit of the future it was about was trying to change the government in Canberra at a future election, and that's cost Queenslanders dearly.
Yesterday, the judge said that at the time it was the right thing to do based on the COVID situation at that point. Do you think that's a fair assumption?
Well, there was always another facility coming online, and the government was still paying for hotel quarantine. It was about getting a get square with a federal government in Canberra where they wanted to turn the screws politically. $220 million for a facility that Queenslanders didn't own, will never own, and never used. That's the consequences for a government that treats money as a plaything and can't properly plan things. Righto, we're off to Townsville. See ya.